Good morning. This is Ruth Hoffman, and I'm with Storen Financial. Welcome to our February 22nd Zoom Medicare Made Clear meeting. We're going to give it a couple of minutes as we have perhaps folks that are lagging a little bit behind, but I appreciate your promptness to attending our meeting. So just to share with you, I here at Storen Financial am their Medicare benefits specialist. And our goal is to help individuals coming onto Medicare to understand what options they have, as well as those that are already on Medicare to better understand their benefits. To tell you a little bit about my background, I have over 15 years of experience in the Medicare industry. I've worked with healthcare insurance clients 65 and older since 2006. I'm certified to sell Part D, Medicare Supplement, and Advantage plans, and I'll share with you what those are if you're not familiar with them. Just to share with you, there is no cost to schedule a Medicare consultation with me. It comes to you at no cost here at the office. And basically the reason why we recommend that consultation, because it gives us an opportunity to evaluate, how you're currently utilizing healthcare services, to review your medications, because that's going to impact you financially, to explain what the healthcare options are available to you once you come onto Medicare with Part A and Part B, and always to explain your financial responsibility based on your healthcare plan selection. So we're going to get started. It's called Get to Know Medicare, and this presentation is approved and put on by United Healthcare, which is one of the carriers that I represent. So here's the top 10 Medicare questions that typically are on the mind of those coming onto Medicare. What is it? How can I get it? Do I need to have Medicare if I work past 65? How does it work? Where can I get more coverage? What does Medicare cost? How do I choose Medicare coverage? When can I enroll? When can I change my coverage? And how can I save money? So let's start with what's Medicare. Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by taxes you paid while working, and it is individual health insurance. What it is not is free. It is not family health insurance, Social Security, or Medicaid. Who gets Medicare? Well, U.S. citizens and legal residents. Legal residents must live in the United States for at least 5 years in a row, including the 5 years just prior to applying for Medicare. You must also meet one of the following requirements: to be 65 and older, younger than 65 with a qualifying disability, any age with the diagnosis of end-stage renal disease or renal failure, and ALS. Do I need Medicare if I plan to work past 65? This is a question I get asked a lot. So if you work for a large employer, which means that it's more than 20 employees, and the health plan is considered credible, then you do not have to enroll in Medicare and you can delay it. You need to enroll at age 65 if your employer has fewer than 20 employees and your coverage is not considered credible. So what if I'm covered by my spouse's employer? Again, if they're a large employer and you wish to stay on his or her plan, then it's not necessary for you to enroll in Medicare, and you can delay that. Getting Medicare while still working. If you do get Medicare while you're still working, it will coordinate with your employer's plan. If you take any part of Medicare, you can no longer be able to contribute to an HSA. That's very important. That could impact you in regards to having to pay a penalty for continuing to contribute to the HSA once you come on to Medicare. Medicare will not cover anyone but you. It is individual insurance, so consider how any dependents will be covered. And when we say dependents, those are persons younger than 65. So what does Medicare cover? So there's two parts to original Medicare. There is Part A, which helps pay for hospital and inpatient care. Other things that Part A covers are rehabilitation at a skilled nursing facility and hospice. And Part B, Medicare insurance, is Part B covers doctor and outpatient services. So doctor office visits, emergency room, labs, x-rays, anything where you're walking in and walking out. Medicare Part A covers hospital stays and inpatient care. And some of the other things that it includes are, for example, prescription drugs and medical supplies used while you're an inpatient, labs and x-rays, operating room and recovery services, skilled nursing services, blood transfusions, hospice, part-time skilled care for the homebound after a qualified inpatient stay. That's a qualifier that Medicare mandates, and rehabilitative services after a qualifying inpatient stay. So fast facts. Part A, you've been paying into all of your working life if you have paid taxes for 10 years or longer, you or your spouse. So there's no premium associated with Part A if you meet that requirement. You can't be denied coverage. Coverage is nationwide, including any qualifying hospital in the US. Coverage and costs are per benefit period. Must be admitted as a patient, not on an observation status for it to be covered under the Part A. And Part A also provides 60 days in a lifetime, and I'll explain that later on. The Part B covers doctor visits and outpatient care. Like I mentioned before, anything where you're walking in and walking out. Your annual wellness visits, for example, like your flu, your pneumonia, COVID, labs, x-rays. Also helps with some health programs like smoking cessation or obesity counseling, diabetic screening, mental health, durable medical equipment. And if you take a trip by ambulance or have treatment at an ambulatory surgical center, again, you're walking in and walking out, is covered under Part B. So some fast facts in regards to Part B. Now, when you enroll in Part B, you will have a monthly premium, and it's based on your adjusted taxable income 24 months prior to coming on to Medicare. So if you want to learn more about, what your premium will be, I would advise you to go to medicare.gov and query what's called income related monthly adjustment amount. It's called IRMMA, IRMMA. And it will tell you what you can expect to pay for your Part B premium. You cannot be denied coverage. Coverage is nationwide. And there could be a late enrollment penalty if you don't enroll in the Part B of Medicare, unless you have what's called a qualifying special enrollment period. So what does Medicare not cover? So original Medicare A and B does not cover all the cost of your care. You will have out-of-pocket costs with no limits. For example, if you're admitted into the hospital and you're just on Medicare Part A and Part B, there is a $1,400 deductible. That's your obligation. Prescription drugs at the retail level. Routine dental, vision, and hearing are not covered under original Medicare. Eyeglasses, contacts, and hearing aids. Long-term or custodial care is not a benefit. Excess charges for service by doctors who don't accept Medicare assignment, and care received outside of the United States except in certain circumstances. So be aware, if you're on Medicare and you travel outside of the United States, you may want to pick up health insurance for the duration of your trip, because you could find yourself in a difficulty with needing medical care outside of the United States and have limited coverage, which could impact you financially. Where can I get more coverage? Well, everything starts with being enrolled in Medicare Part A and Part B. So those two have to be in place to then consider option 1 or option 2. Option 1 is going to coordinate with original Medicare, which means Medicare will pay first, and then you add these components. First one being prescription drug coverage, so that when you go to your local pharmacy, you can get your prescriptions filled at an affordable cost. And then for the gaps that you have with Medicare Part A and B, it would be wise to add a Medicare supplement plan or a Medigap policy. Those are offered by private insurance companies, and that supplement will help pay the out-of-pocket costs that original Medicare would expect you to pay. So under option number 2, you still have to be enrolled in Medicare Part A and Part B. You still pay your Part B premium. However, moving on to option number 2 is basically allowing a Medicare Advantage plan to stand in place of Medicare. So what that means is that when you go to the doctor, the hospital, and the pharmacy, you will be showing your Medicare Advantage card, not your red, white, and blue Medicare card. So Medicare and these private insurance companies have a contractual relationship. And when someone enrolls in a Medicare Advantage plan, Medicare is going to register that in their database. And then they're going to start paying the private insurance company to be responsible for covering the bulk of the costs for services under A, B, and D. So a Medicare Advantage is identified as a Part C. So it's another way to get your Medicare benefits, an alternative to original Medicare. Plan members are still part of the Medicare program, but the benefits are administered by the plan. Plans are offered by private insurance companies. Most plans offer built-in prescription drug coverage, and plans may offer additional health benefits such as vision, dental, hearing, and fitness. The Medicare Advantage plan has to include all the benefits that you have under original Medicare under A and B. And most Advantage plans will also have a prescription drug card embedded in the plan. The other benefits that you get with an Advantage plan, like I mentioned earlier, are vision, dental, hearing, and most include a wellness program or a fitness membership. A Medicare Advantage plan comes in a number of different types. The ones that are primarily spoken about in the marketplace are HMOs, which are health maintenance organization plans. That's a plan in which all of your services have to be completed by providers that are contracted with the plan. If you go outside of the plan will not cover your benefits, and neither will Medicare. A preferred provider plan, or a PPO, is one that allows you to see providers that are networked with the plan, as well as those outside of the network requirement. So it gives you greater flexibility. There are also what's called special needs plans, and those are for individuals maybe that have both Medicare and Medicaid. Some are institutional patients that are in a nursing home. Another one is a chronic special needs plan, like if you have congestive heart failure or a condition like that. So some fast facts about a Medicare Advantage plan. Again, you must be enrolled in both Medicare Part A and Part B, and more importantly, you have to live in the service area. You can't be denied coverage based on current financial or health status, including pre-existing conditions. May be required to use providers and pharmacies network with the plan. Coverage and costs vary by plan and may change each year. There are annual limits on your out-of-pocket exposure, which benefits the consumer because if you have a poor health year, once you hit your maximum out of pocket, then your services under A and B for the remainder of the year in network are covered at 100%. You may be charged a monthly premium depending on which Medicare Advantage plan you enrolled in, and you must continue to pay your Part B premium to Medicare. That is your responsibility. Let's talk about Part D, which is prescription drug coverage. So the prescription drug coverage is also delivered by private insurance companies that have contracts with Medicare. And there's two ways to receive that benefit. It will be either a standalone prescription benefit because you're under option number 1, which is original Medicare, adding the prescription plan. Or it may be embedded in the Medicare Advantage plan, or what we call the Part C, as part of that plan. So prescription drug coverage, there are types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. Specific brand name drugs and generic drugs included in a formulary, and commercially available vaccines not covered by Part B. So that's why when I schedule a consultation, I will require or request that you bring me a list of the medications that you're taking, because it's imperative for us to make sure that we set you up on a plan that's going to cover the majority of your medications at the best cost point. And that's important because if you have a medication that's not covered, then we need to discuss how is that going to impact me financially. So let's talk about a formulary. So you see here on the right-hand side that it goes from tier 1 with a $1 sign to tier 5 with $5 signs. And basically what that means is as we move from the top to the bottom is that as these medications are listed as either being a tier 1 or a tier 5, 5 will be way more expensive than tier 1. So it's a good thing to evaluate what medications you're on, and if at all possible, try to be either in tiers 1, 2, or 3. There is a deductible that may be charged if you are in one of the higher tiers. Typically, that's the way the plan is set up. So on an annual basis, because these private insurance companies have a contract with Medicare, Medicare basically sets the initial coverage. So for this calendar year, whether you start January 1st of 2022 or you start July 1st of 2022, you're going to have $4,430 of total drug benefit. And as you're filling your prescriptions, it is the total drug cost that comes off that number. So let me give you an example. Let's say that you're on an inhaler like a Brio or Symbicort, and you go to the pharmacy to get that prescription filled. Typically, those are tier 3 drugs, so you'll pay somewhere between $45 to $50 at the pharmacy to get that prescription filled. But the true cost of that drug may be like $400. So when the following month comes, you're going to see that your $4,430 is now reduced to $4,030 because it's the total drug cost that comes off that benefit. So the reason why that's important is because when you look at the totality of the medications that you're taking, this initial benefit may be enough for the calendar year. But if it is not, and you go to fill a prescription and now your initial coverage is depleted to $0, when you go fill that Brio, you're now going to be paying 25% of the cost. So now your copay is going to go from $45 to $50 to $100. The plan will cover the other $300. You have now entered what's called the coverage gap or the donut hole. And you do not exit the donut hole until $7,050 has been satisfied between yourself and the private insurance company. If you satisfy that and you still have days left in the calendar year and you go to fill that BRIO and you move into what's called catastrophic coverage, then the BRIO will only cost you 5%. So it's important to review these reports that come to you 30 days in the rear to evaluate how am I doing with my initial coverage, how close am I getting into the coverage gap, and because that will impact you financially. Those are dollars that you're going to have to spend to get your medications. So you must be enrolled in Medicare A, Part B, or both in order to get a prescription drug plan. You may be required to use pharmacy networks. Coverage and costs vary by plan and may change each year. And the Part B premium penalty for late enrollment is a possibility if you do not put your Part D in place. I'm sorry, I wanted to say D. When you're first eligible, unless you have what's called a special enrollment period. Now let's talk about the Medicare supplement insurance. This is the one that coordinates with original Medicare under option number 1. That was several slides back. So whenever you're utilizing Medicare, for your out-of-pocket exposure, Medicare will pay first, and then the supplement or Medigap policy will pay secondarily. So like I mentioned before, if you're admitted into the hospital, Medicare covers everything but about a $1,400 deductible this calendar year. The supplement will pick up that $1,400. You should not have a Medicare supplement and a Medicare Advantage plan. Should not happen, because what happens is that Medicare is only going to recognize the Medicare Advantage plan, and the monthly premium you're paying for the Medigap policy will bring no value. There's 10 standard plans for the Medicare supplement plan. They're labeled by letters, like the Plan A and the Plan G. And depending on which one you select is going to determine the level of additional coverage you'll have for those benefits that Medicare would expect you to pay. And plans, again, are offered by private insurance companies. So the Medicare supplement or the Medigap policy plan helps to pay the Part A hospital coinsurance. It pays for the Part A skilled nursing facility coinsurance, Part B coinsurance and copays. There is additional 365 extra days that the supplement will deliver to you that if you don't have it, Medicare would not cover. Covers hospice, deductibles for A and B. It does provide some limited foreign travel. I still advise folks, if they leave outside the country, to pick up health insurance for the duration of their trip because of these limitations. And providers can charge above the Medicare approved amounts by about 10% or 15%, I'm sorry. So the supplements will pick up those additional charges. What it does not cover is prescription drugs and some of the other routine stuff that we would like to have, like vision and dental, custodial care, and long-term care. Is not something that's provided by the supplement. Again, you have to be enrolled in A and B in order to enroll in a Medicare supplement plan. No medical or underwriting up to 6 months after enrolling in Part B at age 65. That's called your guaranteed issue period. You have nationwide coverage, known provider network, guaranteed renewable as long as you pay your premium. And plan premiums may vary for the same coverage. Plans with more coverage generally have a higher premium, and you must continue to pay your Part B premium to Medicare. So how much does Medicare cost? So there is a fixed amount that you're going to pay for the coverage, usually monthly. Again, that's your Part B premium, and that is tied to that term I called IRMMA, or income related monthly adjusted amounts. There are deductibles that are set again, and co-pays and co-insurances. That's why if you are enrolled in Medicare Part A and B only, it's very advisable to put a Medicare supplement plan in place. So let's look at, what costs you're going to pay depending on what selections you make. Under a Medicare Advantage plan, you're going to have low to no cost on the plan premium. You will have deductibles, co-pays, and co-insurances to a limit. For prescription drug plans, you're going to have a monthly premium. There are deductibles, especially at the tier 4 and 5 level of medications, co-pays, and co-insurances. And then the Medicare supplement insurance or Medigap plans do have a monthly premium. There are deductibles and co-pays depending on which plan you select. So again, with Part C or the Medicare Advantage plan, like it says at the lower part of the screen, there is an annual maximum out of pocket for covered services that will protect the consumer. So how do I choose? Well, it really depends on a couple of things. Number one is going to be, how many dollars do I have in my budget to spend on healthcare? The state of my overall health. Do I want to have flexibility, not having to deal with a network, or am I okay with dealing with a network and having some additional benefits like dental, vision, fitness membership? So it's either going to be option 1 or option 2, and everything starts with having original Medicare A and B in place. So when we have our consultation, this is where we'll have a evaluation of, do I want to have something that I don't have to worry about paying other than a monthly premium for the supplement, and then I go to the doctor or use the hospital and I don't have to worry about any out-of-pocket costs on the way out? Or do I want to have the Medicare Advantage plan, have a lower cost on a monthly premium, have some costs that I will be responsible for at a reasonable level, and have some additional benefits? So again, when you go to consider what would I like to do, basically I've touched on this. The Medigap or the supplement plan does not have the drug plan embedded, whereas the Advantage does. It may offer nationwide coverage, but with many of the Medicare Advantage plans, be aware that if you are traveling, it will cover you for urgent and emergency situations with no regards to a network. No need to be worried about that. Again, the Medicare Advantage plan does bring you additional health benefits that are embedded in the plan. So when it comes to cost, the Medicare supplement plan will have an additional monthly premium. You will have to add the Part D in order to have prescription benefit at the retail level. Under the Advantage plan, the premiums are a lot more affordable. There's no additional premium for the drug plan that's embedded in it. And more importantly, there is a limit to your financial exposure under these Advantage plans. For convenience, original Medicare, you can go to any provider across all 50 states, hospital or physician, as long as they're Medicare approved, you can see them. Whereas with an Advantage plan, it is a network environment and it's an all-in-one plan. When can I enroll? So for those that are coming onto Medicare because they're turning 65, you have what's called your initial enrollment period. So it's the 3 months before, the month of your 65th birthday, and 3 months after. So if you are going to be losing coverage and need to come on to Medicare so that you have comprehensive coverage, you want to enroll 3 months prior so that on the month of your 65th birthday, Medicare Part A and Part B are in place. For those individuals that are enrolling in Medicare due to a disability, they typically will honored the Medicare status after receiving Social Security disability benefits after 24 months. So if you want to enroll and receive benefits, you should go to the ssa.gov or go to medicare.gov to enroll online, or you can call your Social Security office. But everything starts with you initiating a request to enroll in Medicare Part A and Part B. I would recommend you go to ssa.gov. Not only can you apply for Medicare through the Social Security website, but you can also apply for Social Security benefits if you're wanting to get those started. If you need a Medicare Advantage plan or a prescription drug plan, as well as a Medigap policy, you need to enroll directly with the plan provider. You can also schedule an appointment with a broker like myself, and we can assist you with that. So enroll early to avoid gaps in coverage and late enrollment penalties. You may refuse or delay enrollment in Part B with credible employer coverage. The general enrollment period is for those individuals that miss their initial enrollment period, which is the 3 months before, the month of your 65th birthday, and 3 months after. So you can make a request to enroll in A, B, or both. You can do that anytime between January and the end of June, but it does not become effective till July 1st of the year that you're applying. And you will be assessed a late enrollment penalty unless you have a special election period. For Medicare supplement open enrollment periods, again, if you're coming on to Medicare, the last 6 months, beginning with the month in which you are 65 years of age or older and enrolled in both Medicare Part A and Part B, is considered your guaranteed issue period, which means there's no medical underwriting and you cannot be denied. You may enroll in a Medigap policy later, but you could be denied or charged more based on your health history. There's also some other special enrollment periods. For example, if you're working past age 65 and let's say, at 66 and a half, you decide that you want to enroll, you will have what's called a special election period. And you have 8 months in which to make that request to enroll in Medicare Part A and Part B. And you also have 8 months in which to enroll in Part C, which is the Medicare Advantage plan, as well as a standalone prescription drug plan. But if we look at the last bullet points, you have exactly 63 days to get a standalone drug plan or a Medicare Advantage plan with prescription coverage without a penalty. So if you go beyond the 63 days, yes, you can enroll in a Medicare Advantage plan or a prescription drug plan, but Medicare will assess you a late enrollment penalty. So again, let's talk about late enrollment penalties. For Medicare Part A, none if you qualify because the premium is free. If you have to pay a premium and you don't enroll and you do it at a later time, the penalty is going to be 10% of the Part A premium. Part B, none if you qualify for a special election period, like you delayed retiring at 65 and now at 66 and a half, you want to separate from your employer and come on to Medicare, you will not have a penalty, you'll have a special election period. If that is not the case, then the penalty is 10% of the monthly Part B premium amount for each full 12 months period you delayed your enrollment. For Part D, if you have exceeded the 63-day criteria, then the penalty is going to be 1% of the average cost of a prescription drug plan for every month that you delayed your enrollment. When can I change my coverage? So with the Medicare annual enrollment period, it typically starts October 15th through December 7th of each calendar year. And basically that allows you to kind of evaluate what you've been on and decide what you want to do for January 1st of the following year. So you can join, switch, drop a Medicare Advantage plan or a prescription drug plan during this period. You can switch back to original Medicare, or switch, I'm sorry, from original Medicare to Medicare Advantage or vice versa. Switch from one Medicare Advantage plan to another, or you can make the request to apply for a Medicare supplement insurance for effective date of January 1st of that following year. The other enrollment period that we're currently in is called the Medicare Advantage open enrollment periods between January 1st and March the 31st. And it's strictly for individuals that are already enrolled in a Medicare Advantage plan. And their desire is to switch to a different Medicare Advantage plan or return back to Medicare Part A and Part B. If you return back to original Medicare, then they will allow you to pick up a standalone prescription drug plan, and you only are allowed one change during this time frame. There are special enrollment periods that will assist you in not being assessed a late enrollment penalty. For example, if you're moving or you're leaving coverage, whether it's retiring or separating from COBRA coverage, you have 2 full months after the month of your qualifying event to make a plan change. During this time, you may join, change, or drop a Medicare Advantage plan, prescription drug plan outside of the Medicare annual enrollment period. How can I save money? So whether you're on original Medicare or you're under a Medicare Advantage plan, take advantage of the preventative services. For example, cancer screenings, immunizations, bone mass measurements, colonoscopies, those all come to you at no cost. For Medicare Advantage plans, I would say use providers within the network. When you're talking to your providers and they're prescribing, ask if there's a generic or a lower tier prescription drug that can treat your condition. Many of the drug plans, as well as the Advantage plans, have a mail order pharmacy that will help you also save some money. And understand the status in the hospital. If you're in the hospital and you're there for a day or two, you need to be asking, am I an admitted patient or am I being observed? If you're told that you're being observed, then Medicare is going to handle your benefits differently than an admitted patient. And this could impact you financially. So you need to ask those questions. Now let's talk about financial assistance. There are some individuals that may qualify for what's called extra help. And basically, these are individuals that are have few resources, but there are programs out there that will pick up their prescription drug cost. If you have Medicaid, then you may qualify for not only having your prescription drugs covered at a low cost, but also to have your Part B premium covered as well. Where can I go to get help? So these are some of the places that I would recommend. You take a visit to Medicare. Made Clear is through United Healthcare. You can visit United Healthcare. They have plans in the standalone drug, the Medicare Advantage, as well as the supplement. But the sites that I would tell you to visit that are provided by our federal government or the Medicare.gov website. This is has great content. You can also call Medicare. There are folks there on staff that can help you. You can call the the state of Indiana has what's called the SHIP program. And these are individuals that volunteer their time to help folks better understand the transition from commercial insurance to Medicare. And you can also contact Social Security, or you can go to the Family Social Services office that manages the Medicaid program. So what I bring to the table is that I am a resource here at Storen Financial. My primary focus is to meet one-on-one and get a better understanding of what your needs are going to be on the health side as well as on the prescription side, and to give you guidance on how this is going to impact you financially. And our meeting comes to you at no cost. Certainly, you can go online and enroll in plans directly with the private insurance company. But I think it's important sometimes to have a one-on-one relationship with a broker that you can pick up the phone and speak with them directly versus calling a 1-800 number. The other thing I want to touch on very quickly is that I had mentioned that long-term care is not something that's offered under the Advantage Plan or Medicare. There are individuals here at Storen Financial. Alex is one of our staff members. And if you have a question about long-term care, I would tell you to call the office and request a meeting with Alex. And he can walk you through how to apply for a long-term care policy should you have a need for that. So we want to thank you for attending our virtual event. If you have any questions about concepts I shared during the meeting, you can feel free to email me at ruth@storenfinancial.com, or you can call the office at 317-852-7000. So again, thank you for attending our meeting. I hope that your time was well spent with us. And if I can be of any service, I'm here to help. Thank you.